Hi, and welcome to these online courses. My name is Ateş. I am a professor of pediatrics and pediatric infectious disease specialist from Hacettepe University, Ankara, Turkey. And I will talk about pediatric cases of COVID-19, especially SARS-CoV-2 viruses in children. At the end of these courses, you will learn clinical features of COVID-19 in pediatric patients and also the risk of infection in children and the complications. At the end of this course, you will learn the clinical features of COVID-19 in children and the risk of COVID-19 pandemics in pediatric patients. The etiologic agent of the COVID-19 is a coronavirus. The coronavirus name is coming from the electronic scanning microscope appearance of the virus. Under the scanning electron microscope, the virus seems like a corona. So the name is the coronavirus. And the coronavirus family is a very big family. There is at least 1,500 types of coronavirus in this family. The main host of the coronavirus family is the bat. The bat is only mammalian that can fly. And there is a special features of the bat. The bat main host area is around 200 kilometers. This means that the bat can fly in a day around 200 kilometers. By this way, the bat can collect the various type of the virus in her or his bodies. So there is a very big number of the different type of the virus in the bats. So there is a mixture of the virus, and there are sometimes some mutation of the virus in the bats. And the bats has the only mammalian that can fly and also hibernating. During this hibernation, their body temperature is decreased around 8 Celsius. And by this way, there is a stress for the viruses that is hosting by the bats. And each type of the stress can result in mutation in the virus. By this way, there is a new types of virus production in the bats. And the new types of the virus can easily transport from the bats to the different type of the mammalians and other animals. Coronavirus is an RNA virus. There is two types of nucleic acid in the viruses, DNA and RNA. The difference between them, the major difference between them, the mutation rate. The RNA viruses has a very high mutation rate, so the coronavirus has a high mutation rate. By this way, there is a new type of virus productions, and the hostile range can be easily changed by this mutation. Up to 2020, we know there is a 6 type of coronavirus can infect the human beings. The major 4 of them is the seasonal coronaviruses, and they can easily result in upper respiratory tract infection, especially in the children. These type of upper respiratory tract infection usually a runny nose with a stuffed nose. The others, SARS-CoV, is seen first times in 2003 as a small epidemics in the Far East, and later in 2012 the MERS-CoV. This is a new type of, these two is the new types of coronaviruses. One is originated from the bats again and goes through the humans by the cats, the other by the cow and camel. But these two types of the small epidemics from the both SARS-CoV and the MERS-CoV can infect more than 2,000 of the patients and can result in a death of 800 patients. As we talk about the coronavirus that can infect the human beings, we know the first times we know the seasonal coronaviruses that can infect the children, and that those are shown in the pediatric patients around 1960s. Later than SARS-CoV and the MERS-CoV is emerged. The upper respiratory tract infection is very common in the pediatric patients, especially in the temperate climates such as in Turkey. It is seen from the September to the mid-April to the May. And the upper respiratory tract infections is mainly caused by the rhinovirus, coronavirus, parainfluenza virus, and RSV. The four types of the coronavirus is very common in these times of the period, in this seasonal period, and can result in the upper respiratory tract infection. But sometimes this type of the coronavirus can even result in lower respiratory tract infection and even deaths of the pediatric patients. But this is a very, very small number of cases. Maybe 1 in 1,000 or 2 in 1,050 patients can be admitted to the pediatric intensive care unit due to the seasonal coronavirus. But mainly these seasonal coronavirus can result in very mild infections. Although we talk about upper respiratory tract infections due to the coronavirus, the seasonal coronavirus, sometimes seasonal coronavirus, those four types of the coronavirus can result in laryngitis. Especially in the pediatric patients, the laryngitis, 25% of the laryngitis could be result by the coronavirus, seasonal coronavirus. I will talk about this in the later because the SARS-CoV-2, also a coronavirus, can be result in sometimes laryngitis, sometimes upper respiratory tract infections in pediatric patients, but mainly lower respiratory tract infections could be result from SARS-CoV-2. Each virus needs a receptor to enter a cell. And the coronavirus has very different types of receptor for the entry. Different types of the coronavirus can use different types of receptor. Especially the seasonal coronavirus can use salicylic acid, aminopeptides, and sometimes ACE2 for the receptors. But SARS-CoV-2 can use this ACE2. And ACE2 is being processed in eyes, nose, and even in the upper respiratory tract epithelium and lower respiratory tract epithelium. But in the pediatric patients, this appearance is lower than adult patients. And also, ACE2 is exhibited more than adults in the pediatric patients, especially in the gastrointestinal system. So, pediatric patient has experienced a little bit more than adults with gastrointestinal system symptoms.